Hello, my name is Diane, and thank you for your presence in your webinar number 4. Today we will talk about a very important topic that is the management of oral mucositis, main oral side effect that happens on patients subjected to cancer treatment. Photobiomodulation has benefits for all dental specialties. No matter your area, photobiomodulation will bring benefits acting on the biological response of the patient. And the feature of improving the biological response is what makes photobiomodulation so amazing. The main mechanism of action of photobiomodulation are cell regeneration, modulation of inflammatory process that leads to reduced pain and edema, and also vascular and lymphatic effects through the improvement in the microcirculation, immunological, systemic, and hormonal regulation. More comfort, less invasive treatments, improved results, faster healing, new solution, less use of medications is the basis of clinical benefits of photobiomodulation. And today, the greatest fight of humanity is against cancer. And patients need to be strong to face the different types of treatment and their side effects. And oral mucositis is the main oral side effect. The management of oral mucositis is now considered one of the most important areas of photobiomodulation among all the clinical applications of laser therapy in dentistry. Still, is the area of performance of laser therapy that has the most scientific basis, as you can see in these recent articles. Cochrane reviews show efficacy in both treatment and prevention of oral mucositis. And laser therapy for mucositis is recommended by Multinational Association of Supportive Care in Cancer, International Society of Oral Oncology. You can find many scientific studies, all the articles at our website, www.samuslaser.com. Just go inside dental studies and choose your area: oral surgery, maxillofacial, dentistry, periodontics, and oral pathology. So have a look at our website. Mucositis refers to inflammatory, erosive, and ulcerative lesions of any part of the gastrointestinal tract that occur secondary to cancer therapy. And literature typically separates into oral and gastrointestinal mucositis. It causes so much pain that many patients think about stopping their cancer treatment. Cancer treatment, beyond destroying altered cells, also works on healthy ones. Chemotherapy attacks cells that multiply fast, oral and gastrointestinal cells, nails and hair, cells produced by the bone marrow, blood cells, defense cells, and platelets are the target of chemotherapy due to their accelerated multiplication rate. In irradiation therapy, cells that are near the tumor in the radiation range are injured. Thus, several tissues are affected by radiation, such as salivary glands, muscles, nervous tissue, teeth, bones, skin, and oropharyngeal mucosa. And although oral mucositis is the most common effect, there are many oral effects that can be mitigated or avoided when using photobiomodulation. For example, xerostomia, pain, dysphagia, dysgeusia, opportunistic infections, dental hypersensitivity, trismus, edema, neurotoxicity, ototoxicity, and radiodermatitis. Among the main cancer treatments, 5 of them have side effects in the head and neck region: chemotherapy, radiation therapy in head and neck cancer, hematopoietic stem cell transplant, immunotherapy, and target drug therapy. According to the type of the treatment, the risk to develop mucositis increase. Other risk factors, such as dose, type of chemotherapy, type of radiation therapy, type of transplant, autologous or halogen, the patient's immune status, age, and oral hygiene should also be considered. I will show now some examples of mucositis injuries according to cancer treatment. Mucositis from chemotherapy usually are lesions spread throughout the mucosa. Here, a breast cancer patient. Mucositis from radiation therapy have more localized lesions in the area of greater radiation intensity, as you can see in this photo. Chemo, Folfox, plus target drug therapy, cetuximab, Erbitux, are large, long-lasting injuries that are usually started with trauma. Target drug therapy, everolimus or Afinitor, as lesions are such as stomatitis, widespread with continuous occurrence during the use of the medication. Here, some studies showing the toxicity of side effect, the toxic side effect of target therapy in the mouth. And mucositis from hematopoietic stem cells transplant appear as aggressive injuries. Ulceration of the mucosa and evolution of mucositis may induce a severe debilitating condition, predisposing the patient to systemic infections, enteral and parenteral feeding, use of opioid analgesic, prolonged hospitalization, modification or interruption of cancer treatment, harming the quality of life and impacting the patient's survival. According to symptomatology and food type, there are several scales to classify oral mucositis. Can go from 0 to 4. 5 is considered death. And the World Health Organization scale classify grade 0, no changes, grade 1, soreness and erythema, grade 2, erythema, ulcers, and the patient can eat solids, grade 3, ulcers, liquid diet only, and grade 4, aggressive lesions, alimentations not possible. In short, mucositis happen after an injury, which can be chemo or radiotherapy that initiates cell destruction, and apoptosis mediated by reactive oxygen species and tumor necrosis factor. Then, the ulceration is associated with bacterial colonization that exacerbate the inflammatory reaction. And there are 4 phases of oral mucositis: inflammatory, epithelial, ulcerative phase, and healing phase. The inflammatory phase, no clinical effects, but significant submucosal inflammation, which lasts for about 3 days. Epithelial phase, cell apoptosis begins with clinical presence of mucosa, color change, and erythema, like you can see in these photos. Ulcerative phase, rupture of the epithelium with rapid bacterial colonization. Here, oral wounds are present. And finally, healing phase, that can be slow according to the patient and treatment, and may not even heal due to another dose of chemo or radiation therapy. So the laser therapies have to maintain the oral health of patients during oncological treatment, preventing and treating the main oral complications arising from chemo and or radiation therapy. We should divide the management of oncological patient in two parts: oncological dentistry, removal of infections foci, adequacy of the oral environment, oral hygiene and care program, or oncological laser therapy, prevention and treatment of oral mucositis and other side effects. The correct is do both. First, oncological dentistry, and then oncological laser therapy. It is very common, especially for cultural reasons, that patients prioritize the health of the body in relation to oral health. The mouth is seen as a secondary and somewhat intimate place, and hygiene care is directly related to the socio-economic status. But what needs to be said, reinforced, and taught in the general population is that oral health is closely related to the health of the body. In addition to cardiac, diabetic, kidney transplant patients, elderly patients, cancer patients must be aware of the influence that inflammation and oral infections generate in their treatment and evolution of the disease. Oral health interferes with the health of the body and can directly influence cancer treatment, chemo, radiotherapy, and bone marrow transplant. Patients undergoing chemotherapy treatment whose immunity is affected by the medication, if they have any oral infection, it can trigger a generalized infection. Radiation decay or even an osteonecrosis can happen if patients have an infected area in the mouth that receives radiation. Osteonecrosis is a bone necrosis that may be irreversible and progressive. This is a very hard to treat, and usually only incipient lesions can be totally solved. Also, it's important to say that after head and neck radiation therapy, the patient cannot receive any bone interventions, such as implant or extraction. Hence, it is mandatory to do everything that is necessary previously to radiation therapy. And finally, patients undergoing bone marrow transplantation are the greater risk of death if they have a mouth infection. In these patients, the immune system needs to be reset to enable transplantation, and any small infection can be fatal. And it is because of this enormous risk that laser therapy must be added to all cancer treatments. What to expect? By modulating inflammation, the laser can save cells from apoptosis, preventing oral lesions, oral mucositis. Laser can reduce symptoms and pain in installated mucositis lesion and promote the regeneration of salivary glands and adjacent tissue affected by the treatment. We can use laser therapy as a preventive treatment. This requires less number of sessions. The other option is to treat after the lesions are installed with a greater number of sessions. To perform mucositis prevention, it is important to laser in the inflammatory phase up to epithelial. In this phase, laser reduces free radicals and modulate the release of inflammatory cytokines, reducing cell damage and avoiding apoptosis. Protocols that do not follow this rule have reduced clinical responses and cannot avoid oral mucositis. In our clinical experience, we perform laser therapy for at least 3 days for each session of chemo or radiotherapy. The treatment is done after the ulcerative phase every day until the symptomatology improves or total mucosa regeneration. If the mucosa is not completely healed and new chemo or radiotherapy session is performed, laser should be continued. The prevention protocol applies high light dose and multiple wavelengths to promote penetration and modulate inflammation. To treat the mucositis, lower dose of light and red laser is needed to be effective in regenerating the mucosa that is at the superficial level. Here is an application of the protocol in a patient, 49 years old, acute lymphoid leukemia, under intense chemotherapy at the hospital. The video is accelerated but represents one laser session for oral mucositis prevention. The radiation must reach all the areas involved, and this is actually what you see on the screen at the horizon laser. You can irradiate the tongue, cheeks, all the mouth. First, you do the inside oral application. All the areas should be irradiated. And then you do extraoral irradiation, applying laser at the salivary glands. And then on the neck. Usually these patients have some complications in this area and a lot of pain. So we have always to irradiate. And class 4 have this enough penetration depth so you can reach these areas easily. Here, a 48-year-old male patient with multiple myeloma submitted to transplant. We started laser along with the first chemo. We did 19 sections and no mucositis were developed. To do mucosite treatment protocol, you should apply laser over the lesion and apply the preventive protocol in areas without injury if the patient is at the risk of developing more mucositis. This slide shows an example of the visual guidance from Horizon Laser. The application is very simple. You should laser to cover all the mucositis area. You can see here the mucositis. And at the horizon laser, you have to select the size of the lesion. So the software will automatically give you the correct time and dosage to apply. And here is another example of what happens without laser prevention. 5 days after transplant, patient shows mucositis grade 2. If don't start laser, the mucositis advances quickly to grade 4. Here, the evolution of the treatment. It is important to notice that once installed, the regeneration is not that fast once the immunological condition of the patient is not normal. So to help the patient, of course, start the laser as soon as possible. But better than that, apply preventive protocol together with the first chemotherapy. The effectiveness of the treatment is related to the right light intensity in the target tissue. And this can be done regardless of the laser class. But the technology of class 4 horizon laser comes to improve the laser applicabilities. Let's go inside the horizon laser. Horizon has many important features as a class 4 laser for oral mucositis. Penetration depth, pulsing and superpulsing laser penetrate better than continuous mode. Fast irradiation, high power gives more energy in less time. Therapeutic efficiency, 4.9 centimeter square probes guarantees low intensity. And also, that is very important, you can adjust to do any protocol available in the literature. Plus, multiple absorption target for wavelengths achieve more chromophores. The combination and simultaneous use of the different wavelengths provide superficial and deep tissue regeneration. And it is a tendency, the use of multi-wavelengths to do mucositis. And we just finished a 40-patient trial using red and infrared laser combined to prevent oral mucositis. Horizon also has a large tip, efficient for oral, extraoral irradiation and extraoral regions, ensuring penetration and fast application. And also an anatomical tip for intraoral use. And a complete guide inside the software. Let's take a look at how the Horizon is in clinical practice. Look at the same video, the first video. You can adjust the tip, the direction of the tip. And during the application, you just follow the laser software guidance. Very easy to use at the hospital because it's wireless. And also due to COVID, we added an extra plastic cover at the equipment. Or also you can do very nice treatment guided by the software at your dental office. Also, you can turn off the sound too, but I like it. The beep is nice to guide me doing the laser. And finally, let's repeat some truths, some facts about class 4 laser. Are versatile, produce effects in low intensity, promote photobiomodulation, have more resources to promote greater penetration in biological tissue, pulse and superpulse high power, latest technology, yes, less literature for being more recent, yes, more expensive as they have more technological resources and possibilities of clinical application, does not burn tissue or destroy chromophores. Of course, correct parameters must be used, and no risk to patients. Risk can be avoided with the use of a protective glasses. What you can do to reach patients who need you? Reach out to local oncologists to create partnerships with doctors, hospitals, and clinics. Connect with local cancer support groups to reach patients. Post information on oral mucositis treatment on your website and social media. Make sure to document your success and get testimonials. People's stories are powerful. And more importantly, laser therapy allows you to make a difference in people's life. So thank you very much for your attention.